Let's talk about poo. Yes, really. Because doing a simple poo test at home could help save your life. This is called bowel cancer screening, and it's for people aged 50 and over. Your bowels are part of your body that turns food into poo. The test checks your poo for tiny bits of blood you can't see, which might be an early sign of cancer. The test is called a fit kit, and it's easy, free and done in your own bathroom. Bowel cancer screening helps people stay healthy.
I got this in the post, something to do with poo.
Oh, okay. It's your bowel screening kit. I've had one of those. It's a little bit gross, but also a little bit hilarious.
They want me to post my poo. What happened to the postie fans?
Trust me, they've seen worse. It's just a sample. You just put it in a tube, send it off, and they've got it.
I can barely look at it, never mind scraping.
You don't have to love it. You just have to do it because they may find something serious.
Okay, if the postie sends one back, I'm blaming you for it.
Here's how it works. 1. Catch your poo. You can use toilet paper, a clean tub or even cling film over the toilet. 2. Use the stick in the kit to scrape a small sample. 3. Pop it in the bottle, seal it and wash your hands. 4. Post it back in the free envelope. Job done. No stamp, no fuss, just your poo in the post. You'll get a letter with your results in about 2 weeks. Most people are told everything's okay. If they do find blood, they'll invite you for more checks. That doesn't mean you have cancer. It just means they want to be sure. And remember, if you ever notice anything unusual, like blood in your poo, changes in how often you go, tummy pain that won't go away, or losing weight without trying, don't wait. Talk to your doctor. Bowel cancer is easier to treat when it's found early. So go on, do the test. Laugh about it if you like, just don't ignore it. It's your choice, but doing it could save your life. Questions and answers.
How exactly do I know that I've done the test right?
Well, usually the test comes with clear instructions, and the clear instructions will essentially talk to you about how to do the test, etc. What you will then receive the result in the post with the outcome of the test. If the outcome is actually we need to repeat it again, they will then send you the kit again to ask you to repeat it again. But more often than not, you'll find that the testing kit will actually have clear instructions on it, so it's quite straightforward. So there shouldn't really be a reason as to why you'll get things wrong, but things do happen. But you'll be notified of that in post.
What is the test really looking for?
So the test is actually looking for tiny amounts of blood inside your poo that you can't see. Sometimes this can signify something going on with your bowels or with your gut, or sometimes it can suggest something a bit more sinister like bowel cancer.
What happens if the test finds blood?
If the test came back positive that there was some blood in there, then naturally the specialist would want to have a closer look at your bowel. The way we do that is by inserting a special camera into your back passage to have a look at your bowel in more detail. Now this is called a colonoscopy.
Could I have help doing the test?
Absolutely, yes. By all means, ask family, ask friends, ask your GP surgery, and also on the bowel testing kit, there's a telephone number on there as well, and they can also offer you some support in how to actually do the test.
How do I know that I've done the test right?
Well, there are very clear instructions on the bowel testing kit as to how to actually do the test. You'll then receive a letter in the post once you've done the sample and sent it off, and that will come back with the result. If it comes back that they were unable to check the sample for whatever reason, they'll send you another testing kit asking you to repeat it again.
Will I always get posted the kit every 2 years?
Yeah, so the bowel screening program usually is every 2 years. Some places it starts as early as the age of 50 years of age. but generally speaking, yes, it's every 2 years.
What should I look out for between tests?
Things to look out for would be things like if you notice any blood in your poo, if you notice that your tummy is getting bigger and for whatever reason you're not sure, or if you notice that your bowels are being a bit funny and you might be going a bit more regular or maybe not as good as much as you used to, which is unusual for you. You might notice that you're experiencing weight loss for unexplained reasons, so your clothes might not fit you. Or if you're just feeling generally tired and not feeling yourself, then make sure you get yourself checked out. See your GP or contact 111.
Thank you.
Bowel cancer screening helps people stay healthy. Let's talk about boobs. Breast screening is a free NHS health check that helps find breast cancer early before you notice anything wrong. It's also called a mammogram. You'll be invited for a breast screening appointment every 3 years if you're a woman between the ages of 50 to 71. Some people may get invited slightly earlier or later. A mammogram is done by a trained specialist. They will gently place each boob between 2 soft plates on a machine. The machine takes X-ray pictures from different angles. Each picture only takes a few seconds. Some people find the test uncomfortable. If you feel pain more easily or in different ways, you can tell the radiographer. They will listen and support you. Your breast X-rays are checked by specialists. You'll get your results in a letter a few weeks later. Most people are told everything's okay, but sometimes they'll ask you to come back to check something again. This doesn't always mean cancer. It just means they want to take another look. Breast screening is your choice, but it helps catch problems early when they're easier to treat. You can always ask questions or bring someone with you if it helps. Breast screening helps people stay healthy.
Okay, I'm just going to leave it at the backwash for 15 minutes with the conditioner on, okay?
Very late this morning.
And the breast screening this morning, it was really quick.
I got a letter about that. I ain't sure what it is, so just put it away.
You have to chat to make sure everything's okay. They do a scan and take X-ray pictures of your boobs.
Does it hurt?
It's not too bad. It's a bit squishy. They're very kind and explain everything.
I thought you only go if something felt wrong.
Yeah, it's good to go, even if you feel fine. Looks a sign for cancer you can't see yet.
Oh, that's good to know.
Good to check your boobs, just to spot any changes.
All right, go home now and find that letter.
Going for a mammogram.
You come for breast screening?
Yeah.
Yeah, what's your name?
Nicola.
Okay, could have Nicola please. Hello Nicola, nice to meet you. My name's Lisa. Okay, so before we go in to have your mammogram, would you like me to show you around the room and explain what it is we're going to do? Okay, so follow me. Okay, in you come. So this is the X-ray room. This is where we do the mammogram. Okay, so this is the machine that we use to take the pictures. We take 4 pictures, 2 on each breast. We put your breast on here and then we bring this down, little bit of a squash, take the picture, and then we do that 4 times in total, and then you're done. You can go home.
Okay.
So do you want me to show you where we get changed?
Yes.
Okay, you follow me. In you come.
Questions and answers.
Can I bring someone with me to the appointment?
Yes, of course, you can bring someone with you to the appointment. They can either come into the room if you feel like you need more support, or they can step just outside the room while we take the X-ray pictures, or they can stand behind the control panel.
Can I talk to someone if I'm nervous and don't understand?
Yeah, you can talk to someone, you can talk to me, you can ask me anything you like, and we'll explain everything, and we won't rush you, and we won't do the mammogram until you feel comfortable.
Will the scan hurt and feel uncomfortable?
So it is a little bit uncomfortable. We do have to squash a little bit to get a good quality picture, but it's over with very quick.
What does the scan look for?
Okay, so the scan is looking for small changes to your breast. So we're looking for small cancers that can be treated early for a better outcome.
How will I get my results and what do they mean?
Okay, so your results will come out to you in the post, roughly 2 to 3 weeks. They'll come out to where you live. Your doctor will also get a copy of the letter. The results will either say everything is normal, keep checking your breasts, and we'll invite you back in 3 years, or it will invite you back to the hospital for more tests.
Breast screening helps people stay healthy. Cervical screening is a free NHS health check. It helps stop cancer before it starts. The test is for women and people with a cervix aged 25 to 64. You'll usually be invited every 5 years. You might get your invitation by letter, text, or through the NHS app. The NHS app is free to download. People you know might sometimes call it a smear test. The cervix is the lower part of the womb. The test looks for a virus called HPV. It's a common virus that most people get at some point. For most people, it goes away on its own, but sometimes it can cause changes to the cervix. These changes can sometimes cause cancer if they aren't caught early. The test is usually carried out by a woman, but not always. If you'd prefer a female nurse or doctor, you can ask when you book. You can also bring someone with you, or ask for a chaperone to sit in with you. A chaperone is a trained member of staff who stays in the room to help you feel safe and comfortable. If you find the idea of the test difficult or worrying, that's okay. You can tell the nurse or doctor and they'll talk it through with you. There are different ways to make it easier depending on your needs. When you book, you can also request a longer appointment if you think you might need more time. Cervical screening is free, quick, and can help stop cancer before it starts. Remember, you can always ask questions, bring someone with you, or ask for help. Cervical screening helps people stay healthy.
Just have a look. Thank you. Oh, what's that letter there? Oh, it says it's from the NHS. I don't understand. Do you?
Oh, it's about your cervical screening.
What's a cervical screening?
A cervical screening is called a smear test. It's a quick test to help with your private parts.
Does it hurt?
No, it's usually over there quick. You'll be perfectly fine. You might feel a little bit uncomfortable though.
It sounds a bit embarrassing. What about if I don't know what to do?
It's usually a female nurse. You've seen it all before. You'll be perfectly fine, trust me.
Okay, I suppose I want to stay healthy, so I should book it. Would you come with me?
Yes, I'll go in the room with you. And wait in the waiting room, that's perfectly fine.
Oh, thank you very much.
You're welcome, you're going to be perfectly fine, trust me.
Thank you. Alright then, let's get on with this jigsaw.
Okay then. Oh, I think we're going.
Hiya. I'm here for my cervical screening. My name's Hannah Smart.
Okay, Hannah, if you want to take a seat, you'll be called shortly.
Okay, thank you.
Hannah Smart?
Yes.
Come on through. Hi.
Hi.
You've come for your cervical smear today.
Yes, I have.
Should we go over it a little bit before we start?
Yes.
Okay. So the first thing we'll do is we'll go over to the bed and I'll ask you to remove your trousers and your knickers. So then, once that happens, we get on the bed and we'll pop this in your vagina, just like that. We open it a little bit. We use this brush just to go in and get some cells from your cervix. We take it out, all of it, and we're done. Have you got any questions?
Will it hurt? I sometimes feel pain differently to other people.
Some people say it feels strange. Some people say they don't feel anything at all. So I think it could feel strange, or it might feel a little bit of pressure, but it's not pain. And it's done really, really quickly, and they try and get it over and done with, so you just feel as comfortable as you can.
Will it hurt afterwards or feel sore?
No, you'll have no feeling after it. So it's just when we do it, you get a little bit of, it feels like pressure, but that's it.
Can I bring someone with me to help me feel calm?
Of course. So you can bring anyone with you. If it helps you relax, we're happy for that.
What if they find something? Does that mean I have cancer?
No, so if they find something or you've got different results, it's usually because you've got abnormal cells. That could be just the HPV virus. It's really easily treated. They just need to take more smears, so you might have to have them more frequently.
What if I don't understand the letter or the results?
If you don't understand the letter or the results, I would be checking with your GP and asking them to explain it a little bit more. Or I'd ask someone I trust to explain it to me. But I'd always just check with the GP first.
Okay, thank you.
Ready to get started?
Yeah.
Hiya.
Hi.
How was it?
Yeah, it was quicker than I thought.
It's not bad. All done. You get your results in 2 weeks from doctor. Okay?
Oh, thank you very much.
Come on, I'll walk you
Thank
out.
you. Thanks, bye.
Bye, see you again.
Cervical screening helps people stay healthy. Lung cancer screening is a free NHS check for people aged 55 to 74 who've ever smoked. It's called a lung health check. These checks help find problems early, like lung cancer, when they can be easier to treat. If you're invited, it's a good idea to have an appointment. Lung screening helps people stay healthy.
I got this letter from the NHS. I think it's about lung cancer screening. I'm a bit scared about it. It sounds a bit serious.
It's not scary, it's just for people that have smoked.
They don't think I've got lung cancer.
It's just a phone call, no hospital trip, unless you need it.
So I think there's nothing wrong.
It helps people spot any problems.
That sounds all right. I'll give it a go.
If you're invited, the first step is a phone call with a nurse who knows about lung health. They'll ask questions about your breathing and lung health, whether you smoke now or used to, any chest infections or allergies.
Current smoker or an ex-smoker?
I used to smoke then, but I give it up.
They'll also talk to you about keeping your lungs healthy. The call takes about 20 to 30 minutes. If the nurse thinks it could help, you'll be invited for a CT scan. This is a quick, painless scan that shows pictures of the inside of your chest. It might take place in a hospital or a special van near your home. You might be asked to come back in the future for another scan, just to keep an eye on things. Sometimes, people are also referred to other services to help them stay healthy. Getting your lungs checked gives peace of mind and helps find problems early. It's your choice, but saying yes could help you stay healthy. Questions and answers.
What is a lung check and why have I been invited?
So you've been invited in because you're between the ages of 55 and 74, and I'm presuming at some point you may have been a smoker or you're a current smoker. And at the lung health check, you will have a discussion with a nurse and she'll do a brief health check to see how you're getting on at the moment. And then you'll be given the opportunity to go through a risk assessment to see if you're eligible for one of our CT scans to have a closer look at your lungs.
Will I have to go anywhere or will everything be done from home?
So your consultation will be done over the telephone. It takes about 20 minutes. You can be in the comfort of your own home, or if you would like, alternatively, we do face-to-face consultations if you'd like to come with somebody to accompany you into the hospital, and you get an hour's appointment then.
Can the nurse speak slower for me to understand?
Yeah, that's not a problem. Once you get your invitation or your letter, your text, please phone our admin team and let them know that you would either require an extra long appointment to accommodate this, or when you're first phoned by the nurse, one of the initial questions the nurses will ask you is, do you have any specific requirements? That will include things like, do you need any help with your hearing, your sight, your mobility? They'll also ask if you have any requirements like needing extra long on the call. So if you just alert that to the nurse, and they will give you extra time and speak more slowly. and give you extra time to ask more questions.
What kind of questions will I be asked?
You'll be asked questions about your current symptoms. So do you have a cough, any chest pain, any shortness of breath, any abnormal weight loss or loss of appetite? You'll be asked if you've been coughing up blood. You'll also be asked if you're on any medication for your heart, such as cholesterol lowering medication. If you have any background illnesses such as asthma or any conditions such as COPD. We'll also ask about your smoking history. So it would be ideal to try and remember how old you were if you started smoking and when you stopped, and try and remember how many cigarettes you used to smoke a day. All these things will be asked throughout the consultation. And then when we do your risk assessment to see whether you're eligible for one of our CT scans, we'll ask questions like, have you had pneumonia, any history of bronchitis, or if you've ever been diagnosed with tuberculosis. We'll also ask if you've had any exposure to asbestos at all, and if any of your family have ever been diagnosed with lung cancer, and if they were under the age of 60 or above the age of 60 when they were first diagnosed. We also need to know what your height and your weight is before you attend for your appointment. And all these contribute to us calculating your risk score. At the end, the nurse will go through some red flag warning symptoms that you need to be aware of in the future. You can share these with your friends and family as well so they can be aware. And then we'll also go through some health promotion with you.
What happens if the nurse thinks I need more tests?
If the nurse thinks you need more tests, for example, we do refer patients on for some breathing tests sometimes, especially if they've had symptoms from their smoking history, such as a cough or shortness of breath. Then we'll explain what the tests are for and what happens, and we would refer you on through the services. If we think you are eligible for one of our CT scans, we'll explain exactly what happens during the test, what will be expected during the test, for example, the CT scan, and what the risks are. Nothing's ever just left. Everything is explained in detail. And if you have any questions, you're given opportunity to ask questions. We don't know how long some of the tests might take to do, for example, any breathing tests, but we can give you an idea how long it would take to have your CT scan and how long the results will take.
Are there any side effects to the CT scan?
We use a low dose CT scan, so there shouldn't be any side effects. You're not given any dyes or any medications or any drips. The scan literally takes seconds rather than minutes to take. You lie down on a bed, they'll ask you to put your arms above your head, and the bed will go through the big donut shaped scan. They may put you through twice, once for getting your measurements. They'll just say hold your breath and you'll come out. Most of our scanners are in a supermarket near where you live, and you can come out and go straight away and do your shopping or go home. You won't feel any side effects from the scan at all.
Lung screening helps people stay healthy.